Now it's my total pleasure to actually introduce our speaker, our keynote, Jonna Mazet. Jonna is an innovative leader in addressing, really iconic leader in addressing environmental and global health threats through a One Health lens. She is the Vice Provost, Grand Challengers of the University of California, Davis. She's the Chancellor's Leadership Distinguished Professor of Epidemiology and Disease Ecology. She also founded the One Health Institute at the UC Davis School of Veterinary Medicine 15 years ago, just about the time I arrived at Stanford, and we've been friends ever since, where she focused on global health problem solving, especially for emerging infectious diseases and conservation challenges. Dr. Mazet is active in international One Health education service, research programs, mostly notably related to disease transmission through wildlife, domestic animals, people, and the ecological drivers of novel disease dynamics. Over the past decade, she was the global director of a $200 million, really an early warning project, and I think hopefully she'll share some of that, called PREDICT, that was developed with the USAID Emerging Pandemic Threat Program. Jonna was elected to the National Academy of Medicine in 2013 in recognition of her successful and innovative approach to emerging environmental disease and global health threats. She serves on NAM's Forum on Microbial Threats and the Academy's One Health Action Collaborative. Dr. Mazet has a Master's of Preventive Veterinary Medicine in Wildlife and Infectious Diseases. She's a Doctor of Veterinary Medicine and has a PhD in Wildlife Epidemiology, all from UC Davis. We're very appreciative that Jonna was able to speak today because besides being very much sought after as a keynote speaker, she became a grandmother about 4 weeks ago. And we didn't quite know if she would make it to this event, but she did. And I have to say, this new girl child has a very powerful role model to look up to. Welcome, Jonna.
Well, thank you so much, Dr. Barry. That was very, very kind. And I want to thank Dr. Luby as well for being willing to step in if I couldn't get here. Besides all of his, I mean, you really should have heard from him, not me anyway, because he's more amazing in my opinion. But you have so many resources, so many great centers here, so much excellence in global health. It is absolutely my honor to be here with you and to be able to share a little bit of my experience and hopefully hear a lot about the experiences you have here. I see a lot of friends from afar, all the way from the East Coast, the Bay Area Global Health Alliance that we're so proud to be a part of. It's just exciting and vibrant. You all give me the hope and the inspiration that global health will continue. I see individuals here at every stage, right? From deans and university administrators to those of you who've been working and thriving and making things happen in global health, and those of you who are just launching those careers, coming out of graduate school, thinking about a career in global health, and undergrad and high schoolers really considering where you're going next. So give yourselves a round of applause for being here and being invigorated and ready to go. It does matter. What you do matters, and it matters to the world, and it matters to you locally and your families and our future. And I hope that whatever path you choose, and for me, that was twisty and turny. I started as a wildlife veterinarian. You heard a little bit of stuff in there that you might be like, why is this woman here? But I started as a wildlife veterinarian trying to save the world, planetary health, working on conservation, and then realized that what was happening was a collision of crises, mostly caused, actually all caused by human behavior, that were driving public health and global health crises that we couldn't just ignore and address in a silo. So I could work on wildlife health, but I was going to be much more powerful and helpful to the world if I was thinking about how the impacts on the environment that were driving wildlife conservation issues were also causing huge issues for people and their health and their families' health. So that took me in a completely different direction. So with that, I'll share with you some of those experiences and some of the ways that we're trying to address them. I know Stanford is doing an amazing job addressing them as well, and I think it is the power of the diversity of approaches that we're all taking that will help us get to the next level and, frankly, save humans from extinction, because we're on a bad path, okay? And we need to be thinking about all of the moving pieces as we go. So you heard from Dr. Barry that basically this definition. And there are many definitions of One Health. I think that this one is nice. This is the one that is sort of US-centric, US-based. But we have a nice one that's also from the UN agencies plus WOA. Do you guys know what WOA is? Okay, the World Organization for Animal Health used to be called OIE because it's in France, and that's French. There's a nice one there as well. It's quite long, doesn't fit on a slide, so I'm not going to put it up there. This is even too many words for my slides, for me. But the bottom line is, for me, One Health has two central tenets. One is interdisciplinary respect, so that we are really able to listen to each other, learn from each other, work together without any one discipline coming in and overpowering the voices of the other. And then the other is that we're looking at the intricacies of different sectors. In this case, we often talk about human, animal, and environmental health all intersecting, right? So it's the complexity and the necessity to address that complexity that we think about being respectful of each other so that we can actually approach these things and solve them. I think in, frankly, the ivory tower of universities, we've had pressures to publish and be the stars and be the best that drive us away from collaboration. And One Health is part of the movement to say we're not getting where we need to be fast enough to solve the world's crises, and what we need to do is work together. So in my world, I put some of the problems that I've worked on over there under the problem list, but One Health can be used to work on many different problems, and we'll talk a little bit more about that towards the end. The issue is that you can't stop thinking about all of the influences and the drivers that underpin those problems and the creation of those problems. And I actually believe that if we worked on the drivers, we would solve multiple crises at once, right? So if you really look at the climate crisis and you look at emerging health threats and pandemics, the drivers are the same. And it's how we are functioning and our big footprint on this earth, and how we use the earth more as an entity to be extracted rather than to be supported. That is the problem. And we can see this very clearly in what is happening in the world. So as I've been working, as Dr. Barry said, we've both been working probably 3 decades now, right, at least, in this field. We've been seeing emerging viral diseases. And by emerging, I do not mean that these are new pathogens or new organisms or however you want to classify these different etiologic agents. What I mean is we are acting differently on the earth, and we are exposing ourselves, and we are then starting to see those clinically in the impacts of the way that we're behaving. So we used to see about 3 new diseases, viral diseases of people. Then we were seeing about 5. I have some people, and I'm sure there's people here now trying to enumerate that and see what it actually is. I think we got up to 5, people stopped counting, we had a pandemic, everything changed, right? But it is time to be more vigilant about looking forward, not looking back. We already have had a couple of huge issues since COVID, right? With H5N1 influenza, with Mpox, with other new viruses that we are seeing. These are ancient entities. They're just either slightly evolving because of pressures that are in a changing world, or they are because we are putting ourselves into risk by our behaviors. And so we really need to think about that and solve this problem. So in my area, as I mentioned, I'm a wildlife veterinarian first. I've been looking at the evolution of these viruses in their animal hosts. And often, just like we have our own microflora, when the animals have their viruses, they don't get sick. It's not like, and this is when I was young, this is what people said, we can just look for a die-off, a big pile of dead birds or whatever, and then that's the virus we should study. Or more specifically, and still to this day, most people will often say, the most efficient way is just to look for sick people. We do need to look at sick people and understand what's in them. But if we wait until the people are sick, especially enough of them to notice that they're sick of something else, we're already way behind the curve and we're not getting ready to handle that new virus, right? So we need to be looking at the animal hosts and ourselves and what we can give. I still do work in wildlife conservation, and most of the diseases, for example, in endangered gorillas are from us, from interacting with us, because we do research, we do tourism. So we want to look at that cross-species transmission ability, both of the virus, but also epidemiologically. How are we causing the possibility of exposure? And then, for pandemics, we have to worry about what makes a virus suddenly spread human to human, right? And how do we start to understand that better? And this is where there's silver linings of things like pandemics. I think we will see more work in that area to understand especially the human-to-human transmission. And I'm not saying that we can stop every spillover. Just knowing where the viruses are and how they might be able to be out there for exposure to humans is not going to stop every single exposure. But we can know where they are and be ready. Be ready for the first ones. We can do risk assessments. And so that's a little bit what I'm going to talk to you about now. When I started working in this area, and then we started the project that Dr. Barry mentioned, the PREDICT project, which is, I had the honor of being sort of a figurehead leader of 1,000 people working in 40 countries to try and both prepare the country so that their laboratories are ready to diagnose new diseases, to understand what might be out there, give the frontline workers, the clinicians, differential diagnoses of what might be in their area that they just hadn't diagnosed before. We had about 260 zoonotic viruses known to make people sick. Now that means that they were classified by something called ICTV, or the International Convention on the Taxonomy of Viruses. We're kind of moving on. Sorry if you're ICTV fans out there. We're kind of moving on a little bit from that sort of traditional way that we look at viruses. But we were able, through this project, to actually do intensive sampling and forecasting to know that there are probably about 500,000 viruses out there that we don't even know anything about yet that can make us sick. Now, they won't all kill us, right? But we could be infected with them. And so what we aimed to do at the beginning of the project was characterize what we call the zoonotic pool, or those viruses out there available to spill over. And I sort of highlighted that here with the animals and the green, sort of, there's just viruses out there. They might be spilling over to different animal species. There might be a little bit of disease. But it's really when we notice them is when we see really sick domestic animals, especially farm animals that we eat. Not today, right? Today we're vegetarian, nice. Or they spill over into people. And they can amplify in the domestic animals and the wildlife and circulate back and forth there and become more transmissible, pick up different characteristics even before they spill over into humans. So what we want is we want to reduce the blue and the red curves, right? We don't want to be responding after the virus is already sort of attenuating. We want to be ready for it and be able to stop it. And so what we try to do is forecasting, understanding what's out there. That involves getting laboratories ready to be able to detect and diagnose virus. And so we work very hard, and we're able in about 30 countries to bring molecular virology and diagnostics into those countries so that they could pick up on and diagnose their initial cases. And we have some great stories, including picking up the very first Marburg case in a country because we said, you should have Marburg here. By the way, we found it in bats. You do have Marburg here. And then they diagnosed it in a single patient before an outbreak, right? Well, technically, one case is an outbreak if you didn't think you had it. But if your guys turned down the epi geekiness before we had a big bunch of people sick. And so that allows exactly this. You bring down that curve, you reduce it to 1. And that's our goal. And to do that, we had to look at the high-risk interfaces. We weren't interested in every virus every animal had. We were interested in the viruses that the animals had and shed that came out in their urine, feces, saliva, respiratory secretions, if those secretions were available to people in those areas. So we're interested in the interfaces, how people are interacting with those tissues or secretion and excretions, and where that was happening. And frankly, mostly in the tropics, we had the highest diversity of these things happening. You have experts who have worked in all of these places in the audience today, a wealth of great people here. But just to show you, it's not sexy work. You know, we're swabbing a lot of butts all over the world, frankly. And even the amazing people in Kathmandu in that upper level, this is Kathmandu here. We sort of sometimes look at on the bottom, this is the influenza death slide, I call, where the chickens are pooping on the pigs, and there's bulls and shrews that are coming right into the household there as well. The sick chicks and piglets also come into the house at night, and those are the houses up in the upper side. And those people living there were so amazing, such great collaborators, interested in the work, wanting to know what would be most safe for them, that they were willing to go back behind the curtain in their houses and swab themselves and bring us those swabs, right? Amazing people that we were able to work with all over the world. These are bats in the market. They look like they're cooked. They're not. They just take a blowtorch to them to burn off the fur. So they're still, transmissible. Smoked meat, cooked meat, much less virus available to you, but in these live and freshly dead markets, there's still a lot of transmissibility opportunity. So again, we looked at the zoonotic pool, as I mentioned. It was green in the other slide, but looking at the animals, trying to get the early recognition. And then we had a second phase of the project where we tried to triangulate, what about the people that were sick? And what were they sick with? And did it match up with the viruses we were seeing in the animals? And in addition to the sick people, what about occupational exposure? What about the people that were working with these animals, for example, harvesting guano or attracting bats to their farms, putting the guano either directly onto the food or using UV sterilization by drying it to take it to market? Did that work? So we were looking also at what wasn't making people sick, what they were getting exposed to and not getting sick with. And that was sort of the second phase of this project. And what we found, this is a little bit old, I'm sorry, because since the pandemic, more and more work got done on the samples, so there's more. But just as a proof of concept, what we were really doing was trying to strengthen the capacity of the countries where we were working, but at the same time, we were looking at the viruses and trying to see if we could design an early warning system. And we were able to train almost 7,000 people in One Health. And with USAID's help, they went on to another project that actually ended up the One Health Workforce Next Generation Project. More than 100 universities in Africa and Southeast Asia joined the networks and this project, and I think they're up to almost 100,000 people trained now. So my little paltry 7,000 looks like nothing there, but I was very proud of it at the time. And we sampled about 164,000 people, wildlife, and domestic animals. And the most important thing probably is strengthened about 60 laboratories in the 30 countries where we work so that they could pick up those infections in sick people and in research samples. The proof of concept was that we found about 1,300 viruses. Again, this slide's a little bit old. 80% of them were novel to science, right? And they were in secretions that people could be exposed to very easily. So about 80% were unknown. That helped us to start, again, with intensive sampling per species. We could look at saturation curves, how much do we need to sample each species to get every virus that is being shed. The 20% there, the known viruses, some of them are just, not very significant, but many of them were very bad actors. Ebolas, influenzas, other things that we were worried about, like Marburg. And then we had scientific discovery along the way, and that's where we all make our living, right? In the scientific discovery, and we're all encouraging you to continue. We were happy to put out this paper in 2013 that actually identified the ACE2 receptor as a required receptor that at least one possible receptor that could be used by these SARS-related coronaviruses, and showed us that we didn't need intermediate hosts to change the virus in a mammal before it got into people. These viruses could be coming directly from bats and exposure to bats in caves and things like that. Now everybody knows what an ACE2 receptor. When we put this paper out, and that's like, yeah, okay, sort of interesting. It made it into a very good journal there, but it was not so exciting until the terrible pandemic, and then everybody learned. I was giving podcasts to everybody about the lock and the key, right? The receptor there and the spike protein. Okay, and what did we learn about coronaviruses? Well, we certainly found a lot of coronaviruses, more than 180 in the end. And if you see here, the majority of them were hosted by bats. So ancient viruses hosted by ancient taxa, and then when the pandemic happened, we were able to dive into that and say, okay, what kind of bats? Where might the origins be? Where should you be looking? Talking to Chinese colleagues before we couldn't anymore, saying, hey, it's the rhinophilid and hippocytarid bats that you should be looking at because a huge majority of these coronaviruses are hosted by these bats. And the really useful thing of that is that you can start to look at the home ranges of these bats. So you don't have to sample every single place for every single species intensively to know where these viruses should be. This is how we sort of put on the differential list Marburg. If you have the host, and we found it on different points around the host home range, you have the virus, right? And so the doctors should be ready for those viruses in those areas. So you can see here that when we looked at the coronaviruses, it was not just China, it was sort of all of Southeast Asia that we should be thinking about and knowing that there was risk of spillover. And in fact, this work from some of our team in Vietnam was able to look at rodents in Vietnam and say, okay, rodents get captured, they get taken in to be bred for the food supply. They also get taken directly to market. And when they're in the field and being captured, about 20% of them have detectable shedding of coronaviruses. You put them into a market situation, what are you doing? You're stressing them out. You're putting them in high density, so they have the opportunity for exposure to each other in a stressful circumstance where they're more likely to be shedding virus. Then you mix them with a whole bunch of other species that might have a relative of that virus, so they have the opportunity to pick up new characteristics. And when we're there, about a third of them we could detect shedding. Sadly, when they got all the way through that value chain, that human consumption value chain, and made it to the restaurant, often in Vietnam, the restaurants butcher live at the restaurant, right? That over half of them were shedding coronaviruses that were available to people. So this isn't just like a one-off. Oh, amazing. I'm surprised these things don't happen so much more often. And in fact, what we found in southern China and in Africa with the different filoviruses and the different Ebolas, they happen all the time. We found communities that had no record of ever being diagnosed with an Ebola that had a prevalence of exposure to using very specific serological tests to the different species of filoviruses, that they had 10% past exposure. So sometimes we're pretty resilient too. We get infected, we don't get sick, right? There does have to be kind of a perfect storm often for these viruses to take off. And that's where we're lucky. Nature's on our side until she isn't. So let's not abuse her so much, right? Okay, so this is just a little bit of a plug for what happened after we weren't working in these countries anymore. When the pandemic struck, we had already finished up the work for months. The pandemic struck, and all of the people that had been trained that I showed in the previous slide jumped in and had all of these roles. In places like Rwanda, the only person that had ever written a paper about a coronavirus had been on our team. They were immediately on the task force, right? The highest level task force for their country. In Tanzania, our folks were on the Prime Minister's task force and were doing infection prevention and control at the airports. In Vietnam, in Cambodia, in Thailand, we saw the very first cases introduced into the human populations, into their countries, detected, and the public health system put into place, and global follows and everything being done. Now, all that started to fall apart when things got political and very heated, right? And then everything took off. And sadly, our public health systems in almost every country sort of failed us on this one. And hopefully, you all are going to fix that, and we'll never have that happen again, because I need you to. I have a grandbaby. Did you hear that? So please help her. And we worked very closely with communities as collaborators, and they were amazing. Most of the communities we worked with, and this is a challenge to you, most of the communities we worked with said, people like you come from universities in the US and the UK and Europe and work with us and never come back and tell us what you found. And we would have to, have the ability to find a scientific publication and have access to it behind a paywall to even know what you found. That is not okay. Please don't do that. Please work with the communities, come back and talk to them, no matter what venue, and listen to them on how they want to receive that information. We also came up against lots of political things in the countries where we worked. Some of the countries that had been ravaged by the 2014 and on Ebola epidemic did not want to announce that we were finding Ebolas, right? Because their people were traumatized and there were election issues, like people made campaign promises about disease. I hope that we can stop doing that. I hope that we can stop politicizing disease and health, but for sure we had to figure out how to get them information in a way that also didn't disrupt the social and economic and political systems. That is a challenge. This is why we need One Health. We need social scientists. We need community-based organizations all working together with the virologists, the epidemiologists, all the different ologists that you all are out there in the audience. So we developed this Living Safely with Bats book in two different contexts. We did an Asian context and an African context, not trying to say every place in Asia and Africa is the same, but it worked in that we had it translated into multiple languages, and it was delivered mostly at community meetings so people could ask questions. So it was actually translated on the fly into, it was probably about 100 languages. So pretty amazing way. And we had the reaction of, again, the community collaborators, like, crying and saying, we couldn't even talk about Ebola before, and now we're learning how to protect ourselves from it happening again. And it was probably the most powerful part of the project. All right, so enough of that project, maybe. The follow-on is we could start to put together tools to say, let's get prepared and let's rank viruses and see where we need to invest into further surveillance and where we need to understand and do more laboratory work on these viruses, understand how to develop countermeasures, how they work in our systems. And so we went out to the experts, tried in many countries as possible, got expert opinion to develop a risk ranking system. If this looks like your credit score, that's on purpose. We were really working to say, we're not just looking at the virology, we're not just looking at the virus, we're looking at what's happening with the host and with the environment. And those are changing things. We were able to do this for rank these viruses for all the ones we found in PREDICT, because we didn't feel like we could just say, okay, good luck, we found 30 viruses in your country, hope you do a good job with it. We wanted to help the public health system say, which ones should we be most worried about. I'm happy to say we put in quite a lot of the known zoonotics to help give us sort of a gut check on whether we were ranking them properly. Now we have a whole new effort with CEPI. Do you guys know CEPI? The Coalition for Epidemic Prevention and Innovation. Something close to that. I work with them, but anyway, so we are now bringing in every virus we can find in GenBank and research and trying to put that into this system using AI. And we're making pretty good progress. And you can generate watch lists. This is on available spillover.global, but stay tuned because it's going to be even better soon with CEPI's help. So we'll have a whole new interface. The work also allowed us to look at hotspots and rethink hotspots and where we should be looking for coronaviruses and other viruses, and you can see that Amazon was the hottest spot. This is the desertification or savannization that is happening right now in the Amazon, and of course this is completely linked to climate change. Now, this is a projection. This is not how bad it is yet, right? But as we are having these colliding crises in planetary health that are the existential threat, frankly, to our existence, we are pushing into forests, and we found and predict that where the ecosystem and the landscape was changing was the most probably environmentally stressed out area and where we found most virus being shed and being available. So people go with their domestic animals and they push into these environments, right? And then these domestic animals are very susceptible often, as are the humans, to the viruses that they've never seen before in evolutionary history. So this is the most dangerous thing that is happening, I think, right now, to our climate and to our health. So we looked at how might you address that without sending armies of people that can get infected into the Amazon and destroy it more through research. And there are a group of folks in this KAA initiative, sort of headquartered out of Brazil, that are developing bots and drones with NASA, with CSIRO in Australia, all over the world. People are collaborating to figure out how do we sample, do the least damage, leave the viruses at least before they're inactivated where they belong and where they come to equilibrium, but still be able to know about them and be ready. And it's fun. There's a lot of fun engineering. Engineers are amazing, and using biomimicry, there's just amazing things going on so that these bots can climb to the top of the canopy and sample from the orchids at the top of the canopy to see what the hummingbirds put in their saliva into the water left up there. Very fun stuff. But this is not new. Way before PREDICT, this is a group of folks I worked with. We were documenting that climate change was impacting the movement of viruses around the world. We talk a lot, obviously humans move viruses, we move our viruses around the world. We've also talked about for decades the changes to climate affecting vectors, right? Mosquitoes especially we talk about, and where they can live because of temperature. But it's not just that. So here is where we showed that with shrinking polar sea ice, animals were migrating into areas they had never migrated into before in history, at least since we've been monitoring sea ice. And we saw this distemper virus moving from the North Sea into the Pacific Ocean, and species in the Pacific Ocean were getting sick. Sea otters specifically, I didn't put them because they're too cute. And we were starting to document, again, like 16 years ago, all of these changes in zoonoses that were happening with climate. So I encourage you to be thinking in this holistic way and bringing in collaborators with many different disciplinary expertise. All right, so I'm now a vice provost, not really doing this anymore. I'm now in university administration. I can't help it, I'm still tinkering, and one of my grad students is here. But she'll be my last, sadly. So say hi to Jonna Mazet when you're here. She's working on metagenomics and proteomics of viruses and bats, so there's a lot of good work to be done. But what we decided was we wanted to use the One Health approach to tackle what our campus might be able to help with in the world's wicked problems. Shouldn't say that anymore, right? I'm using you because the movie ruined my wicked problem thing. You know, everybody's just thinking about good witches and bad witches. I'm mostly a good witch. So anyway, we started to look at what our campus was really good at and where we were punching below our weight for solutions. Why aren't we helping more? And we felt like it's because we're not coming together and using this approach of collaboration, looking at complexity and bringing the right people to the table. So we identified which of the world's biggest complex problems we felt like we could help with more if we brought a One Health approach. And for Davis, you don't even care, this is more for administrators, but we're transforming, engaging, and empowering. That's not good, right? So emerging health threats is, I see I'm not a very good administrator. It's all right. So emerging health threats, obviously, we did a bunch of post-pandemic work, including making roadmaps for universities, academia, and the private sector to be more incorporated into our public health system. And we developed a roadmap for that incorporation for government, as well as for other universities, in case anybody's interested. It's not rocket science, and a lot of different universities who did amazing things during the pandemic collaborated on these recommendations. We also started jumping in on all of the emerging infections and doing emergency consultations and bringing people from all over the world to give their recommendations very early. In H5N1, our teams in Latin America were documenting that the virus was going mammal to mammal, and people were still not worried about it because they're like, oh, not mammal to mammal spread. We're like, yes, tens of thousands of dead marine mammals, mammal to mammal spread. Is God talking about it? Yes! So it's still a little bit frustrating, and there are good reasons why we want high quality work that is very well vetted, but in a public health emergency, we cannot wait for Nature and Science for a year and a half to get our papers out. We need to listen to each other and find different mechanisms, so that's another challenge for you. But we also put together a research agenda, got that to the White House, got that to the national academies. Hopefully that's helping, I don't know. Tying that, again, as we already discussed, to the climate crisis, and then looking at sustainable food systems, and that's our other one. Davis is a world leader in agriculture and food systems, and so we wanted to work on our strengths and say, you know, we have actually 5,000 researchers on our campus working somehow in food systems, and almost none of them, if they were in a different department or school or college, knew each other, right? That's not acceptable. We needed to do better. So we're working very hard in sustainable food systems. Every single part, from soil science and carbon sequestration in soil even, all the way through to what we do with food waste. We can donate it, but we can also make energy from it. We're also making green ammonia from it. And one of the only biodigesters in the world that you can actually make ammonia and make fertilizer again without petrochemicals and other things. So it is shocking, I'm sure not to all of you, probably some of you here are food insecure. But we have just about 1 in 5 Californians don't have enough high quality food to eat. In urban areas, we have food deserts where you can't get fresh food, only crap, sorry. But, and we just need to really address this whole system and make sure everybody's healthy. People make their personal choices, me too. Gained a lot of weight over the holidays, so not as healthy as I should be, but this is no joke. This is a huge crisis. So we're connecting the sustainable food systems, the climate solutions. Of course, nutrition affects our resilience to health issues and being able to respond to health. So all of these things are connected. So that's 3 of our 4 grand challenges. The last one is reimagining the land-grant university. We're a land-grant university. That means we took land from indigenous peoples and built up our endowment, not like your endowment, by the way, but built up our endowment, and we have to reckon with that terrible history and learn how to work with our colleagues in the tribes that, without permission, donated that land. We also need to rethink the land-grant universities were created to help society. At the time, and I think it was 1849, the Morrill Act, maybe 1853, the idea was to work on agriculture, check, and weapons. And that's what society needed. That's what we believed. I obviously wasn't alive. But that's what was believed. That was the justification for taking the land. These days, I think it's the things I just talked about. And we have not changed our merit and promotion system in our university to actually encourage people to work together and solve problems. We encourage them to get a science and nature paper, right? Or Lancet, or whatever, right? And so we need to rethink how people are rewarded so that they can actually work on the things that are so important to society and planetary health. So that's what we're trying to change at UC Davis now. It probably won't happen before I retire, but we did get a little bit of change in the merit and promotion system already. All right. So this is some of the highlights of what we've been working on in that area. But I encourage you, as you are the next global health leaders, to think about what else needs to change and how you might affect that change and what your role is in that, because I believe that you have the power to make a positive impact. And find some place great to work, and this is one of those great places to make that happen. Thanks. Happy to